Alright, future nurse, let's tackle this NCLEX question of the day. So, a nurse is caring for an 80-year-old male in respiratory distress. In which of the following positions would it be most appropriate for the nurse to place the client in? So, let's look at the options. Option A is supine. This is when an individual is lying flat, so this is not ideal for somebody in respiratory distress. Option B is dorsal recumbent. Now, this is not often seen, however, it is important to know when you're taking the NCLEX. Dorsal recumbent is when an individual is lying flat, but their knees are flexed and their feet are planted on the ground. It is not for somebody in respiratory distress, but it could be seen in a client who is getting or preparing to have a Foley catheter inserted. So, not the answer. So we've narrowed it down to options C and D. These are two types of Fowler positions. In my last video, I broke down which of these positions meant. So if you remember or saw that video, high Fowlers is when the head of the bed is 60 to 90 degrees, so they're sitting upright. And semi-Fowlers is when the head of the bed is 30 to 45 degrees, so they're sitting up but not as high as they can. And for an individual in respiratory distress, we want them in high Fowlers because it's going to help us expand the lungs and alleviate the pressure on the diaphragm. I hope you learned something from this question. Follow for more.